Whether or not the material of a pipe can have public health implications. So, broad answer, yes. The perfect example of that is lead. Lead pipes can leach lead into water. Now, people have been using these materials for a while, including lead, and engineers who run water treatment plants and architects of big buildings, engineers who run buildings, they've developed a lot of tricks and knowledge of how these pipes interact with the water itself. So, I'm not an engineer, so fair warning, this is me sort of looking outside in on the situation. If water is treated properly, again, a layer of, we call it scale, oxidation or chemicals, form around the surface of a pipe material that prevents a ton of leaching, a significant number of leaching after a point. So sometimes problems can cause this scale to go away, or unusual rare chemistry can cause a increase in leaching. So a good example is the building I actually worked at back at my school I got my PhD in. Brand new building, state of the art, all copper plumbing, deliberately all copper plumbing. At one point, a few months after the building opened, the water started turning blue. And it was because the water chemistry was funny to the point where it was leaching so much copper from the plumbing, it actually became toxic to humans. And the solution was to let scale build up over time. So that was a rare circumstance, I don't call it rare, atypical circumstance that caused due to chemistry in the water, leaching that material. So in a normal building connected to a water distribution system that is operating properly, copper and iron shouldn't have noticeable health effects on anyone who's not very sensitive. One situation where this might be relevant, specifically to a healthcare setting, and we're seeing more and more a treatment method, on-site treatment method for hospitals called copper-silver ionization, where copper and silver ions are actually introduced to the water at the hospital as it comes in an attempt to control bacteria. Legionella problems are often attempted to be remediated by hospital staff by introducing these copper and silver ions. If they are not maintained properly, you can easily introduce toxic levels of copper or copper-silver into water with these copper-silver ionization systems. So specifically for people in the medical profession, that is something you want to worry about much more so than the drinking water coming into your building.